Hi, it's Mark from Remarkable Speaking. I'm here with Will Cito. He's the clinical director, the owner of InSync Physiotherapy in Vancouver. And we're going to talk about your health. We're going to talk about knee injuries today. How you doing, Will?
I'm good, thanks. Yeah, I want to talk specifically about knee injuries in ultimate.
So is there something different about knee injuries that have to do with this sport?
The reason why I want to talk about ultimate frisbee and knee injuries as well is because I have some experience with it personally. I used to play competitive ultimate frisbee and I've sustained a knee injury, and it just seems like a growing sport that keeps growing here in the Lower Mainland. And there's a lot of cutting and there's a lot of fast starting and stopping type of movements, and then pivoting, and then things that basically cause you to plant your foot, and then you have to like change directions really quickly. A little bit more so than like soccer. Football's a little bit different, but like football, you get tackled below the knee. But I think it's something that's worth talking about because there's actually a high rate of knee injuries related to sport. And I used to work a lot of frisbee tournaments and teams, and having my experience working with national teams and at world championships and world games, definitely see it at the high level to the more recreational levels. So you can classify the knee injuries as either overuse, repetitive type of injuries, or more like acute and traumatic injuries. And so I think it's really important to get a feel for like when you have an injury, if it doesn't get any better after like 48 hours, and especially if it goes 3 or 4 days and it's still not getting better, then you should probably get it looked at because you want to really get an accurate diagnosis of what's going on. And so this is where like if you have a repetitive type of injury, then you want to really see, okay, well, what's going on in there? You may not have had contact to the knee, or let's say you did, but maybe you're not really sure because you can get things like overuse repetitive tendinopathy, and this is an overuse injury in the tendon of the quads that attaches below the knee. And that's very common. Or you can get an overuse syndrome in the kneecap where it's like pulling on what's called the IT band. And so there's this syndrome called IT band syndrome. And so those are two of the more common type of overuse type of injuries in the knee. And especially with younger athletes and with ultimate frisbee now being taught in the school curriculum. So you have these kids who are growing and they're playing the sport and they're starting to play it at a competitive level. And so you can get a condition where it may seem like an overuse injury, which it could be, but then there's this condition called Osgood-Schlatter. So it can be a serious condition where, like it's the insertion point of that tendon onto the bone, because with maturing bones and maturing athletes, their bones aren't fully formed yet. And so it can cause disruption of that attachment point, which is important to treat and to really look at and manage. So that's sort of the repetitive and overuse side of things. And then things that we see a lot of in the clinic as well is the acute stuff. So whether it's a ligament injury from your medial or your lateral ligaments, which is called the medial collateral or the lateral collateral ligaments, or some of the more major ligaments in your knee, like your ACL, which is the anterior cruciate ligament. And then usually if you have like something bigger happening within that, you can also have an injury to your meniscus, which is basically the shock absorber in the knee, but it also acts not just as a shock absorber, but also provides more normalization of your movement of that knee. So quite often when you have an injury to, like, say, your ACL, the major ligament in your knee that provides stability, and this can commonly happen if you're planting your foot and then you go to pivot and then change directions really quick, or someone just hits you lightly, but you're planted, it can injure that ligament or your MCL or your meniscus. Quite often there's a term, it's called the triad of injuries, which basically involves all three. So your ACL, MCL, and your meniscus.
If this has happened, I've hurt myself playing ultimate frisbee. My knee is hurting. It's not getting better after 48 hours, like you said, but I can't get in to see my doctor. That's a really common thing these days. Is it actually all right for me to get in to see a physio who can diagnose exactly what's going on? And if I need referral to a doctor, you're going to refer me to a doctor?
Exactly. And it's actually even better if you come see physio first, unless like there's the rare occasion where I have some clients who their doctor is really adept and they can get in to see them and they're able to like, hey, yeah, I know exactly what's going on. But typically what you want to do is you want to come see your physio first. And we do work with your doctor or doctors, and that's the healthcare team. For example, we had a gal who injured her knee earlier this year, actually. I think it was back in January. I can't remember how she did it, but she ruptured her ACL. Fortunately, it was just the ACL and there was nothing else going on with meniscus or MCL. And she wasn't really sure what to do. And she was very uncertain and she was like, starting to train. She wanted to do like her first Ironman and then felt really deflated. But when we looked at it, I said, you got to get some scans done, get this looked at. So I sent her back to her family doctor. But also in that visit to her family doctor, I recommended that she see a specialist that I connected her with. And then also recommending that maybe we should get some scans. Turns out that she had that blown ACL, complete rupture. And, and there's different options for that, but it's just good to know that diagnosis. And that's what I was suspecting. But if we have that accurate diagnosis, whether it's like assessing it through us at the physio clinic, but then getting more details through scans that we recommend, it's going to help us guide you towards the management of this injury or injuries, whatever is going on, because we want to okay, so this is what's happening. It's not just an overuse injury. So we have to be careful with this. And this is kind of how we want to progress. Or if it's like just an I'm not saying just, but if it's just an overuse thing happening and it's not like a major ligament injury at all. And quite often people may think that it could be, right? Because they're having pain and it feels clunky or whatever. Then we want to start to progress it and work on the rehab and the treatment and the management of that non-acute aspect. So that way we can get it better faster.
So diagnosis is really important. What's a typical course of treatment?
Well, first and foremost, if it's, acutely injured, even if it's a repetitive thing, like it could be like a repetitive overuse, but it's just like recently flared up, we want to just let that settle down for the first 24 hours, at the most 48 hours. Typically with injuries, they'll settle down within 48 to 72 hours. So ice, compress, elevate, they'll follow the Price principle. So protect it, rest it, ice it, compress it, and elevate it. And then we want to start to get it moving a little bit more. And we start to look at, well, the body's going to compensate like you wouldn't believe, like within those first 24 or 48 hours. So we want to start to normalize not only the motion as best we can, but the ability for that knee to take on weight and to take on load and resistance. And that's important. And depending on what's going on with it, we want to be careful what kind of load that we're going to do. So for example, if it's a completely torn ACL, we're not going to do certain things within the first 48 to 72 hours in terms of loading it. Versus if it's an overuse thing, then we will load it in a different way. So that's important to know because like you don't want to do certain motions if it's a torn ACL. Versus if it's an overuse thing, we do want to work through if it's an overuse of the patella tendon or whatever it is, we want to work through certain things to get it moving better. So then we know how to prescribe things. We know what to release and what things to really focus and get you back playing again.
If you've injured your knee, if it's hurting, get in to see the physiotherapists at InSync Physio. You can reach them in Vancouver, 604-566-9716, or on their website. You can book right there, insyncphysio.com. They have 2 locations. They're also in North Burnaby. You can call them there at 604-298-4878 or book online. Same thing. Thanks, Will.
No problem.